A Positron Emission Tomography (PET) cardiac viability scan is a specialized procedure that uses radioactive traces to determine the amount of heart muscle that is still alive but dysfunctional versus muscle that is permanently scarred. This information is crucial for deciding on the best treatment, such as revascularization, bypass surgery, or angioplasty. Is critical to ensure the heart muscle uses the glucose tracer effectively, as the heart normally prefers fatty acids for energy. Dietary restrictions or fasting. Do not eat or drink anything except water for 6 hours prior to the scan. A low carbohydrate, high fat diet for at least 12 to 24 hours before the scan. Patients are often required to follow a high protein, high fat, and low carbohydrate sugar-free diet. This shifts the body's metabolism away from using glucose, forcing the heart to rely on fatty acids. Activity restrictions. Avoid strenuous physical activity or exercise for 24 hours before the test, as this can increase glucose uptake in skeletal muscles, potentially interfering with the heart images. 3. Medication health review. Inform the healthcare provider about all medications, especially diabetes medications like insulin or oral agents, as these may need adjustment or temporary discontinuation. Notify the staff if you are pregnant or breastfeeding. Remove all metal objects, jewelry, watches, etc., and wear comfortable, loose-fitting clothes. 2. The Perfusion Scan, resting blood flow. This part of the test assesses the blood supply to the heart muscle. IV line placement. An intravenous IV line is inserted, usually into a vein in the arm. Electrodes for an electrocardiogram, ECG, are placed on the chest to monitor the heart's electrical activity during the scan. 2. Tracer injection. A short-lived radioactive perfusion tracer, e.g. 99-mTcm IBI N13 ammonia, is injected through the IV line. This tracer distributes through the bloodstream to the heart muscle proportionally to its blood flow. Imaging. The patient lies on the scanner table, which slides into the PET/CT scanner. The patient is asked to lie very still, with arms often positioned above the head. The scanner detects the radiation from the tracer to create the perfusion images of the heart, which typically takes 5 to 15 minutes. The Metabolism Scan, glucose uptake. This phase assesses the metabolic activity of the heart muscle using glucose, which indicates viability, glucose loading, and blood sugar management. The goal is to increase glucose availability and insulin levels to force the heart muscle to switch its energy source back to glucose. Non-diabetics. The patient is typically given a glucose solution to drink. Diabetics. An insulin and/or dextrose glucose solution may be administered intravenously under close supervision to adjust the blood sugar level to a target range. Waiting period. There is a waiting period, typically 30 to 60 minutes, to allow the glucose and insulin to take effect and ensure optimal heart muscle uptake. Third tracer injection. A second radioactive tracer, F18-fluorodeoxyglucose, FDG, which is a glucose analog, is injected into the IV line. Second imaging. After another waiting period, usually 45 to 60 minutes, to allow the FDG to distribute and be taken up by the heart muscle, the patient is scanned again in the PET/CT machine. These metabolism images take about 15 to 20 minutes. Post-scan and interpretation 1. Recovery. The patient may be monitored briefly. They are advised to drink plenty of fluids to help flush the harmless radioactive tracers from the body. Results. The results are sent to the referring physician to guide treatment decisions. Why choose Narula? Best nuclear medicine and radiology team with vast experience in advanced imaging techniques. Cutting-edge technology ensuring accurate, reliable, and early detection of bone and joint conditions. Comprehensive patient care with personalized guidance from specialists. Trusted by thousands of patients for diagnostic excellence and compassionate care.